Excellent. So our next speaker is one of our brilliant trustees, Dr Joanne McCormack. So please welcome Dr Joanne McCormack.
Thank you very much. I'll need the other mic as well, please. Thank you. So, right. So, who's heard me talk before? Okay, quite a few, but quite a few not. Thank you. So that was me. So 2013, I thought I was a normal weight, just a bit chubby. My husband found that photograph for me, the one on the left, very kindly, and pointed out that I was actually a bit overweight, actually to the tune of about 2 stone. So I never set about losing weight. I actually wanted to reduce my risk of diabetes and dementia, and I followed Dr. Perlmutter's 30-gram a day carbohydrate diet for 4 months and became my new self, which is obviously like 4 years ago. Okay, so this is my website, Fat is My Friend. And what I try to get over to people when they come to my groups or I see them one-to-one is that your fat can be your friend in reducing your blood glucose and protect you from harm. And that's how I saw my fat. I wasn't diabetic. I just thought, well, it's there, you know, it's one of those things. But when I changed the amount of carbohydrate I ate, the fat fell off to the extent I became too thin for a while. And I say to people, look, not everyone has the ability to get fat. Stop thinking about fat as a negative thing. I mean, anybody here want to put their hand up and say they just can't get fat no matter what they eat? Okay, so we've got one person in the middle, maybe 2, 3, 4, sort of nervously putting your hands up. But it's true, some people don't have the ability to get fat, and sometimes they become diabetics. And like David said earlier, we advise them to still follow a low carbohydrate diet, but they may have a higher amount of fat in the diet. So I'm a GP, and I show people how they can change if they want to change. You know, I sort of back off and say, look, it's only if you want to. So I thought I'd talk us through 5 quick scenarios that have actually happened to me in the surgery. And I try when I can to weave in behaviour change and talking about nutrition into different consultations. So I actually need volunteers to actually read from a script. So the first one is a woman who came to see me with an overweight child. She didn't bring the child with me. So would somebody like to volunteer as that woman and read from the script? Yep, please, yeah, please come down. There we go. Okay, please take a seat. Hi, I'm Dr. Jo. How can I help you?
My child is very overweight, and even though she's very active, she could not be more active. She does line dancing and swimming and gymnastics and everything. And I even feed her exactly as it says in the NHS guidance, you know, 1/3 of her plate is carbohydrate. What can I do?
Oh, I see many people who get overweight if they follow NHS guidance. I really do. And this actually happened, and she actually said the 1/3 of her plate is carbohydrate. Would you be willing to change how you feed your daughter? And do you think she'd be willing to change how she eats?
What would it involve?
Well, basically you change her and actually the whole family gradually over to eating unprocessed food. Just like in the green card in this picture. You can see that it's got, you know, lots of real foods in it. It's got chicken and meat and vegetables. You can see that it's actually got snails in it, which was quite a nice idea, but not that popular. And you can see it's got whole milk in it. But that's the idea. For instance, you know, you could start with breakfast and think about real food. What do you think? Would you be willing to give it a go? You can actually just say what you think.
Yeah, I think we'd be happy to give it a go.
Yeah. So that's it, really. You cut out things like bread and pasta and rice and potatoes and dunk all the junk, cut out the sweet stuff. And, you know, I've got my email address here, so you can let me know how you get on. And if you've got any problems, just let me know.
All right. Thank you.
Okay. Thanks for coming in.
Thanks.
That's great. Take this with you.
Okay.
So the next one, another volunteer. is, excuse me. So a dad of a child with asthma came in. And when I got through to the end of the asthma consultation, examined the child and prescribed some medication, we were just sitting there. So if somebody would like to come down and volunteer to be the dad of a child with asthma. Otherwise, it'll have to be Sam. Okay, thanks. No? Oh, someone do it. Great, that's brilliant. Yeah, it's better to get, I like to get audience participation. Here we go. So. It's very short. Okay. Yeah. So this actually happened after the consultation was over. So, right, so I've given you a prescription. You know, just go away and come back and see the asthma nurse in a few weeks.
Okay. Is there anything else?
Well, there is actually something else that might be helpful. It's a bit of a funny one. Would you have time to discuss what your son eats or what you feed him each day?
Just the usual stuff, cereal for breakfast or a bagel, sandwich or fruit for lunch, all sorts of things for tea, always home cooked.
Would you be willing to consider cooking him a meal in the morning instead? There's evidence that a higher level of nutrients helps keep children full for longer. It can improve their concentration and can help them develop and grow. It might actually help with his asthma even.
What sort of food do you mean?
Well, I realise you don't have much time, so here's a card just to show you. And basically, you stick to the foods in the green circle as far as possible, and particularly for breakfast. Yeah, well, a lot of parents, I don't know how you feel. This is ad-libbing, actually, but...
Let's ad-lib.
Yeah. What does your son... Your son has cereal in the morning for breakfast.
Every morning.
Yeah, and it's just thinking, you know, would you find the time to cook eggs, for instance?
Well, I could do.
Yeah. So my husband and I had
whether he'd eat it.
Yeah. So basically, things like eggs would have a lot more nutrients in them than cereal. And my husband and I had a race one day. So I made eggs in the microwave, and he poured his cereal, and we raced each other to the table, and I beat him just a bit.
Was it as tasty though?
Well, it's important, isn't it, to have tasty food for kids.
It is.
So one of the websites I recommend is one called ditchthecarbs.com, and it's devised by a mum.
Thank you, Doctor.
Yeah, so it's devised by a mum with young children. She's got 3 young children. She's called Libby, and she was a pharmacist who now works designing a low-carb website. So she's got lots of lovely ideas for kids. So maybe try some of those.
And her kids like it?
They do. They only make it to the website if the kids like it.
Okay, thank you.
Thank you. So this time I need, it was actually a young woman who came in with absolutely terrible eczema. The younger the person who comes along, the better perhaps, but it doesn't really matter. So if I could have a woman along, or indeed a man, who, yes. So please go ahead. We got anybody sitting near the edge? Okay, yep, brilliant. Thank you very much. Thank you very much. There's the card. Hi, I'm Dr. Jo.
Hi. Oh, my skin is terrible. It's itching and I can't stop scratching. It's weeping in all these places. It's everywhere.
I'm very sorry to hear that. Can you tell me a bit more about yourself?
What do you mean?
Well, just tell me a bit about your life and what's going on in your life at the moment.
Well, I live with my mum and dad and brother. I go to work, and that's at Mackie Do's. And I go to college. That's about it, really.
Would you mind if I asked you what you eat?
Well, I get free food at Mackie's, so I just eat there every day.
Do you mean that that's the only food you eat? Like, you don't eat any food that you or your parents cook for you?
Yeah, that's right. My mum and dad work shifts, and we just all get in at different times. Also, the food at Mackie's is free, so it just saves me money.
Well, the thing is that your skin needs nutrition, and the food from Mackie's is not going to help in your skin getting better. You know, your skin needs to heal, and it needs to, you know, your cells change all the time. You know, it needs to, your cells grow, and they need nutrients to grow. Would you be willing to buy some of your own food and cook it for yourself? Would you have the time and the money? Would you give it a go?
I suppose I would.
Well, these are cards I give out to people just to give them examples of real food. And I also give them my email address so they can actually tell me if they've got any problems. You'll see in the back there's some websites with recipes for real food. And if you're willing to give them a go, that would be great. And also, because your skin's so bad, I will have to give you some conventional treatment with creams, and I'll give you a prescription now.
Okay.
But I'd like to see you again in a couple of weeks, and you can let me know how you get on.
Thank you.
Okay, thank you. So what happened with this lady was that she was about 90% better in 2 weeks, and she did adopt a real food lifestyle.
Go on.
You can keep those. You can keep this. Okay. So the next one is a woman who cannot control her blood glucose using the Eat Well guide. Okay, yep, come along. So this lady was somebody who I actually didn't feel terribly positive about helping, because she was aged about 82 and she'd been on insulin. Yep, so you have to walk a bit more slowly. She'd been on insulin for several years, and she was also on some tablets for her diabetes. So there we go. Hi, I'm Dr. Jo.
Doctor, my blood sugars are always high. Even though I do exactly what my diabetes nurse says, I don't understand it.
Oh, I'm sorry to hear that. Well, what does she say, and how high are your blood sugars?
My blood glucose is usually between 8 and 14. The nurse told me to eat cereal for breakfast with fruit, a wholemeal sandwich for lunch with some more fruit, and chicken or fish for dinner with vegetables and potatoes. I always have my 5 a day.
Oh, I can understand. I can understand why your diabetes is not well controlled. Every time you eat sweet or starchy food, your blood changes that into glucose, and so your blood glucose will go up, and your body cannot get it down. It's actually better to avoid starchy food and to base your meals on a small piece of meat or fish or eggs, and to add in some non-starchy vegetables. Good fats can help too, because they don't raise your blood glucose.
So why has no one told me this?
I don't know, and I'm actually really sorry. I really can't explain how it's happened, but it's all been a big mistake. In fact, you might come across other doctors and nurses who say I'm wrong and the guidance is right, but it's clearly not working for you.
No, it clearly isn't.
So
how soon will it work? I think we've lost the...
Yeah, no, so basically a different approach is needed. So what I tend to do is give people some written information. Is that all right?
Oh, yes, please.
So I've actually got some written information for diabetes medication changes, which, you help yourself to them afterwards.
Thank you.
In general terms, when you go onto a low carbohydrate diet, because that's what I'm talking about, you eat more real foods like that, in the green circle.
Oh.
And tasty things. And I often, if people want to go on diabetes.co.uk, that's pretty good for low carb.
Okay, I'll give that a go.
And it will actually work right away. From the time you start it, your blood glucose will go down, so you will have to decrease your medication. So there are details about that on the sheet. And I don't know if you'd be interested. I'll give you a blood glucose meter today and some sticks. Would that be all right? Yeah?
Yes, please.
Yeah.
Yep.
And would you be interested in coming to my low carb group?
Yes, please. Do I get to eat some of this food while I'm there?
Sometimes.
Yes, please.
Yes. So you can just turn up at the low carb group. There's no waiting list, and just come along. It's every other Tuesday.
Great. I'll be there. Thank you.
Thank you very much. You can take those away. That's fine. You can take those. Yeah, that's great. Okay, so an extra thing that happened in that consultation that I didn't put in was that the poor woman told me that she hated eating foods like potatoes, pasta, rice, and cereal. She said, I loathe those things. I only eat them because the diabetes nurse told me to. So here's the final one. So I don't know if anybody's early on in the low carb journey and they've still got some weight to lose, or quite a lot of weight to lose. No? Okay, so anybody just turn up, and this is a person who's come for a minor op, and you've got to imagine that this person is actually markedly overweight. So just anybody come along. Okay, good. That's great. Lovely. That's great. Thank you. So if you just imagine this person is lying on the examining couch, I never miss an opportunity. Now, obviously, sometimes when you talk to people, they're not interested or engaged, but I actually talked to this person who was lying down and had just had a local anaesthetic, and while I was waiting for the anaesthetic to work, I said, as a matter of interest, how do you feel about your health at the moment?
Well, I'd like to lose weight, but I've tried everything.
Can you tell me what you've tried?
Well, basically, GI diet, really. Weight Watchers, Slimming World, calorie counting. I can't do any of it. Or it works for a while and I lose a lot, but then I pile it all back on more than before. I used to be quite fit too and play rugby when I was a lad. This is news. I've had a sexual day, right? I've got more problems than you think I have. Sorry.
No, it's great. It's great. I was hoping a woman would do this. Right. Well, I'm pretty certain you've got a condition called insulin resistance. It means you put on weight more easily than other people and responds very well to a way of eating called low-carb or keto. I can give you some information if you like.
Yeah, I'd be interested. Yeah.
Okay. So I'll do your operation for you now, and then I'll give you some information on the way out.
Thank you.
Okay. So basically, it was this and the websites, and I also invited him to the low-carb group.
Thank you. I would say I was 14 stone 2 last September, and I've been doing low carb.
Wow, big round of applause. Fantastic. So next I thought I'd talk you through my low-carb group. Sam, if you could just remind me when I've just got 10 minutes to go, if that's okay. So my low-carb group runs every other week. I've done it in general practice. I'm currently doing it in a church where the vicar's given me free space to use. I could probably use it every week if I wanted, build it up. And so my low-carb group is for anybody who wants to improve their health. It's obviously focusing on diabetics, and it's focusing on people who are overweight. But a lot of people have a terrible diet who are normal weight. And as you know, my website's called Fat is My Friend, and that's one of the things I say to them. You know, your fat's there for a reason. If you're not able to get fat and you're eating a lot of sugary, starchy food, that's got to go somewhere. And if it's not being converted to fat, it's been doing you harm. And if it's being converted to fat, it's creating a situation you're not happy with. So one of the things I do is, at the beginning of any talk, is focus on hope. And this is something I learned from the Unwins, and you'll have heard it before. So I'm going to treat you, and you need to pretend you're all doing a bit of role play now, and you need to pretend you've chosen to come along to my low-carb, change your eating in 8 weeks group. That's what it's called. So I say, I'm Dr. Jo, and you've chosen to come along to my low-carb group, which is about changing your eating and changing your behaviour over the next 8 weeks. And it's all on the internet on my website called Fat is My Friend. And I give them out the cards so they can email me and they don't abuse it and I don't get too much to do. But they all go into my spam, so there's obviously a time delay. I give out Zoe Harcum's cards, which is the first introduction to the idea of eating real food. And then I talk about hope. And what I say to them is, and I'd like all of you to do this. So I'd like you to think about your own individual health and how it would be, how you'd like it to be a year from now. And a year from now, what that healthier you will look like. And if you want to close your eyes and imagine that healthier you. And not only how you'll look, but also what you'll be wearing and who you'll be with and how you'll feel inside yourself and how you'll feel about yourself and about the foods and drinks you'll be eating and drinking and how you'll, just picture that new you. And then I'd like you to think about how you're going to get there. And the stages you're going to take and the first steps that you're going to take on that journey. And then I'd like you to open your eyes and try and carry those thoughts in your head through the meeting. The meeting lasts about an hour. I try and finish it just before the hour's up, maybe about 10 to or 5 to. And if the conversation seems like it's going to run on, I invite people to stay behind at the end rather than taking over and stopping people from leaving, because I do think that if a meeting goes on too long, it's hard to concentrate. So the first meeting is to do with breakfasts. So how many of you here eat breakfast most days? Do you want to put your hands in the air? Okay. Now, how many of you never eat breakfast or rarely eat breakfast? Okay, quite a few. And I'd like you to pretend that you're in my low-carb group, and this is your very first meeting. So it might be actually thinking back to the time when you weren't a low-carber. And I'd like you to tell me what you have for breakfast if you have breakfast. If somebody puts their hand in the air and volunteers what they have for breakfast. Yes? Shredded wheat. Yeah, shredded wheat. That's a good one. Okay. So how many of you here would have thought that shredded wheat was a very healthy cereal back in the day before? Yeah, most people. Okay, well, I used to think that too. And so my favorite breakfast was bran flakes. And depending on the size of the bowl, I might have had maybe 40 grams of carbs. Now, how many of you are diabetic here? Because I should have actually said that early on. So every diabetic gets one of the diabetes medication letters. And because I'm running a church group, I tell them to see their diabetes nurse or doctor about reducing the diabetes medication when they go onto a low carbohydrate diet. But back to breakfasts. So the trouble, if you're diabetic or you want to lose weight and you're having a high carbohydrate breakfast, the problem with it is that it might just keep weight on you. And if you check your blood sugar 1 to 1.5 hours after you've eaten your breakfast, you might find that it goes up to 15 or 10 or 8. It just depends, who you are, because we're all individuals. So although I'm doing this talk for a group, you'll all have individual likes and dislikes with food, and you'll all have individual responses in terms of how much weight you lose and how low your blood sugar becomes. On that note, I'd like all of you who are diabetic to have a blood sugar meter. Okay, so what's the problem with that? They cost too much. Okay, so I say to you, I'd like you to go to your diabetes nurse or doctor, the one you trust and love the most, and butter them up and see if they'll give you a blood glucose meter. I'll let you into a secret. They're all free to the practice. Okay, but the buts, as my mother says, the sticks are very expensive. And so you might just persuade them to give you enough for a month so you can learn. So this is a learning exercise, and you need to learn what happens when you have bacon and eggs. You need to learn what happens when you have shredded wheat. You need to learn what happens when you have... what's the most popular breakfast for diabetics? Porridge, yes. It, sends me into a slight sort of quiver. Okay, so I have these... Yes. So, breakfasts. So, if people tell me they haven't got any time, I say, well, that doesn't take very long. Greek yogurt and some berries and maybe some almonds or walnuts or something like that. Other breakfast. Who says you've got to have breakfast food for breakfast? What about last night's leftovers? What about meat and vegetables and salad or fish and salad or something like that? Pardon? As the French do. What do the French do? Yeah, that's a very good idea. Meats and cheeses, very true. And when I used to go skiing, I broke my leg a few years ago and I don't go skiing anymore. When I used to go skiing, I used to love the breakfast we had in the chalet, which were a selection of meats, cheeses, tomatoes, no problem at all. I just left off the croissants. So the next thing that I say for breakfasts that are fantastic are... Okay, so a couple of egg stories. So only last week at my group, my doctor told me to only have 2 eggs a week. Okay, so I said, it's a different sort of cholesterol, and Dr. David Unwin in his studies has shown that most people get a lower cholesterol when they eat a higher good fat diet, low carb diet. So I'm not worried about that. And in any case, you're an individual. So if we check your lipids in 3 months and your lipids are normal, and lipids is a collective name for cholesterol, triglyceride, and so on. If your lipids are normal, it doesn't matter how many eggs you eat. And then I tell them a story about my friend Mike, who's a GP in Manchester. And Mike had a patient who told him he had 14 eggs a day, raw, and he was into bodybuilding. And Mike was so excited that he texted me in between patients to tell me. And then he said, and you know what? His cholesterol's only slightly up. So that was that. Other foods. I do talk about, obviously I can't take along fresh food very easily. It can go off if I've been working all day. But I do talk about other things that are very easy to eat, like fish. So quite a lot of my older patients like the idea of kippers, for instance. This is just a reminder about kippers. There are no kippers in this. But tinned fish, the smash fish, I probably won't, I've got 10 minutes left, good. Smash, like salmon, mackerel, anchovies. Ones that people worry about having really large fish, don't they, because of mercury, but small fish seem to be fine. And a lot of people like tinned fish, they've just never thought about it. They think in terms of calories in, calories out, and not in terms of nutrients. But Zoe Harcombe often says like liver and sardines are, very high nutrients. And I try and encourage people to think about getting nutrients from food rather than calories in, calories out, or even about weight loss. Now, I've only got 10 minutes left. So the other two things I talk about in the talks are mindfulness or finding other ways to relax. So I've got a little card that I use, which has got all the advantages of mindfulness. And I do say to people in my talks, look, I don't mind if you use your mobile phone. I don't mind if you look at websites. I don't mind if you photograph things and use them for yourself, or indeed share them with your friends, either on social media or just email them to people. So come up afterwards, I say, and just photocopy things. So this is about mindfulness. And when I went on my journey to improve my health, and that's how I think of this rather than just weight loss or getting rid of diabetes, when you're on your journey to improve your health and you want to change your behavior, it's very helpful to do something that really helps you relax. Because when you relax, your cortisol goes down and your adrenaline goes down, and those are both your stress hormones. And when that happens, it helps you control your blood sugar. It also helps you make good choices about what you want to eat. And mindfulness is one of the tools that you can use. Now, I did a very specific sort of mindfulness. I did an 8-week course, which was just a book. And it's by Professor Mark Williams and somebody called Danny Penman. And Professor Mark Williams is from the University of Oxford, I gather. And it's a very simple little program, and I actually happened to do it just before I changed my lifestyle, and I think it probably helped me. Mindfulness has it has a few different things within it. Now, one of the things is being very mindful over the next week, before you come back to the next class or the next 2 weeks. Try and be very mindful about your food. When you eat it, make sure it looks really nice. Don't eat it standing up in the kitchen when you're, all preparing other food. Just put it down on a plate and have a nice plate and knife and fork, and preferably eat with your family or friend. And take your time over the food. Look at how it looks, how it smells. Really concentrate on the taste. Don't wolf it. Take your time over it. And that's very helpful in helping to reset your relationship with food. Now, the other thing I learned from mindfulness was something called a habit releaser. Anybody here know about habit releasers? One person, maybe two. So habit releases are really interesting. So basically, if you change one habit, it becomes easier to change another habit. So this is, and habit releases tend to be very, very easy to do. They're things that are of no consequence. You think, well, I'll do that. That's no problem. And so there are two sorts of habit releases I could tell you about today. One of them is just to sit in a different chair when you're eating your meal. So if you always sit in the same chair, just sit for a week in a different one. It just changes your perspective slightly. Another one would be to drive, if you go to work, drive a different way to work each day this week, and take your surroundings into account. You know, just really have a very mindful journey. And if you don't go to work, you know, you could be going somewhere else regularly. Just drive a different way. So that's it about habit releasers. And each week I'll do a different habit releaser. That's probably it for now. And I'm here to take questions. Oh, there is one thing actually. This should have been a prompt for me. And it's actually very important. So this was an introductory meeting today, and I said about cutting the carbs and about eating real food, and you've got pictures of this real food. But in reality, we're looking for blood sugars between 4 and 7, where 4 is the floor. And we're not looking for blood sugars of 10 or 15, or rather, we're looking to learn from blood sugars of 10 or 15 and thinking, what happened? Why did I wake up with a blood sugar of 10? Was it that bag of grapes I had last night, for instance? But the aim of this is to reduce your blood sugar gradually over time, and for you to learn what causes your blood sugar to go up and what causes your blood sugar to stay normal. Now, with that in mind, I take a step firmly in the camp of try 30 grams a day of carbohydrate. I recognize that that is didactic. I recognize that there may not be evidence for it. But do you know what I think? I think, why on earth do we extrapolate from RCTs of hundreds of thousands of people to you as an individual? You know, each of you, and I look at you individually, is an individual. And if you start on 30 grams a day, you see what your body does with 30 grams a day. Now, if you do it gradually, you'll probably not notice an enormous difference. But if you do it tomorrow, you'll probably get terrible low-carb flu. So what I say is learn all about it and do it in your own time, whenever you want to change over. But if you're a diabetic, I strongly advise you to go for no more than 30 grams a day, because I've seen that work for many diabetics. And it might be too much for you. You might need to be on 20 grams a day. But then you'll say to me, what is, and this is where the learning thing comes in, what is 20 grams a day? What is 30 grams a day? And so this is the book I recommend. Obviously, some of you may want apps. Some of you may want other books. But this one I particularly like because it shows you, for instance, bran flakes. I used to have bran flakes, as I said, for breakfast. Shows you what 22 grams is, what 44 grams is, shows you what it looks like, shows you how many carbs are in it. And you can't really have a 10-gram meal with bran flakes, not very easily. But if you have 2 eggs and spinach and maybe some mushrooms, you'll be well under your 10 grams for a meal, and possibly under 6. And because Dr. Richard Bernstein, who is an authority on managing diabetes with low carbohydrate diets, recommends having a lower amount of carbohydrate for breakfast, and so that might be 6, and then up to 12 for lunch and 12 for dinner. So that's about it for today. If any of you want to come and talk to me afterwards, that's absolutely fine. If any of you have questions after the meeting, by all means do email me or come back to the next meeting, and then I'll give you a list of dates. So thank you very much.